Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to part 2 of this Integrative Movement Insider 3-part video series on training thoracic rotation. If you missed part 1, be sure to check it out because the concepts from this video will develop and build upon the ideas we introduced in the first video. In the first video, we introduced some of the common reasons our clients lose thoracic rotation, and in this video, we'll look at the correct exercise patterns we use with our own clients and patients to improve and maintain thoracic rotation. Now, my friend and colleague, Dr. Linda Joy Lee, came up with this idea of a thoracic ring, and as part of her thoracic ring approach. Now, Dr. Linda Joy Lee, did her PhD on motor control and kinematics of the thoracic spine. So she's really the leading expert on the thorax. And her idea of the thoracic ring is that the two ribs, the pair of ribs, joining to the vertebrae posteriorly and then the sternum anteriorly form these theoretical rings. So if you look straight down, this ring will be formed by the left ring of T8, the right ring of T8, the vertebrae, T8 vertebrae, and the sternum in the front. So again, T1 through T10 is formed by these rings. And in order to create and maintain optimal rotation, we want to make sure that we have these rings properly aligned and controlled. One of the first ways we do that in our approach is to make sure we align and stack the thoracopelvic cylinder. And that's a cylinder that's created from the first ring, so the first pair of ribs and the first thoracic vertebrae down through the bottom of the pelvis. And this is a theoretical cylinder that must be aligned and controlled to create pure and efficient rotation. When our clients don't do a good job stacking their cylinder, so a lot of our clients will present with one of two positions. They'll either be kyphotic, where the thorax is overly flexed and behind the pelvis, or they come in with the posture of being overly extended. They've lost their thoracic kyphosis, and again, the thorax is stacked behind the pelvis. Both these positions will limit and alter the ability of our client to rotate. So our first and most important step in improving thoracic rotation is to ensure that our clients have stacked up their thorax over top of their pelvis as much as they are able to. Now, some of our clients will never get it completely stacked up, but what we want to do is improve their ability to align the thorax over top of the pelvis, or the pelvis underneath the thorax. So in that process, you will do your manual therapy work. You will do your three-dimensional breathing. One of the things that we do with our clients is we don't do tons of manual therapy work. We'll use it as we need it. However, what we do very well is we teach our clients how to align that thoracopelvic cylinder. We put them in positions where they can control it, and then we teach them three-dimensional breathing. Because three-dimensional breathing will activate the muscles like your intercostals, your diaphragm, your psoas, your pelvic floor, all the muscles whose job it is to keep this thoracopelvic cylinder aligned and controlled. So the positions we tend to use the most are the happy baby position. So we often do happy baby position lying on the back, and that is the happy baby position. So we want to make sure that our client is best lined up as possible. So we want their head and neck aligned with their thorax, thorax aligned with the pelvis. So that's our first primary goal, is to stack up that thoracopelvic cylinder. Once we get the thoracopelvic cylinder aligned and they're starting to use that three-dimensional breath, again, those are the two most important things we need to do prior to getting our clients up and rotating, is then we'll teach them how to dissociate the thorax from the lumbar spine and pelvis. And that just means like getting the thorax to rotate relative to the lumbar spine and pelvis. Now, of course, there will be some mobility down to the lumbar spine, but most of the rotation is going to happen up here in the thorax. Now, when we look at our clients rotate, they're going to look as if they're rotating on a pure transverse plane. So they're going to be moving this direction. But ultimately, that's not how these rings move in normal kinematics. They actually, technically, will rotate like that, and as they rotate to the right, so my right, the ring will rotate like that. So it's not this pure transverse plane motion like spinning on a flat surface. It's more of a three-dimensional movement of the rib cage. However, when we look at our client rotating through a lot of our patterns, it should look as if they're rotating on this flat plane. So we want to see that they stay long through the spine and that they rotate around that central axis. Now the central axis being right in front of the spinal canal. And the research has shown that this is where most of the thoracic rotation occurs, is just directly in front of that spinal canal where the spinal cord is coming through the vertebrae. And that makes sense because you don't want to be overly translating or shearing across the spinal cord. You want to make sure that you're rotating basically around the central axis, which runs just in front of that spinal cord. So when we're looking at our clients doing rotation, we want to see that their head and neck are lined up, their thorax is stacked over top of the pelvis. And again, that's important of setting them up prior to doing rotation patterns. And now we're going to watch for pure axial rotation or rotation around that axis. So here's how we set our clients up. We generally will have our clients do half kneeling position because the half kneeling position will also allow us to get lengthening through the myofascial chains, and it's a great way to get active lengthening of these chains. So we put our clients in half kneeling position and we get them stacked as they can be. So their head and neck will be aligned, their thorax will be positioned over top of their pelvis, and they'll be in a nice tall active position. They're not going to be here hanging out, they're going to be here hanging out, they're going to be active and long. They're going to put their own hands upon their thorax because we want them to understand where and how rotation actually occurs. We're going to have them take a deep breath in. We've already taught them deep breath, or three-dimensional breathing, I should say, in the happy baby position. Now we're going to do it in the upright position. They put their hands on their rib cage. They're going to take a deep breath in. As they let go, they will rotate. They can let their head come with it, and then they'll take a deep breath in to come back to center, and then they'll rotate the opposite direction. And we want to think about that rotation happening around an axis. And that's why it's real important to watch your client to make sure they're not overly translating out to the side, they're not extending, they're not flexing, that they're relatively rotating around that central axis without any transition. So they'll breathe in to return to center, and breathe out and rotate. So again, at this point, we're also lengthening those myofascial chains, but we're creating that pure axial rotation as if they're rotating around an axis running down through the center of their head, down through their tailbone. Excellent, excellent pattern to teach your client how pure rotation should happen. I'll turn to the side so you can see it from the side as well. So set the client up, half kneeling position. Nice and tall, stack the head and neck, stack the rib cage over top of the pelvis, and now you're ready to go. Hands go on the rib cage, deep breath in. As you breathe out, rotation happens. And again, I want to stay active and long, making sure I'm rotating upon that axis. Breathe in to return to center, and then rotate away from or towards the forward leg. Breathe in to return to center, rotate away from the forward leg, breathe in to return to center, and then breathe out, staying long through the axis as the client rotates. So that way, we're training pure axial rotation. We're getting lengthening of those myofascial lines. We're also creating that three-dimensional breathing in the upright position. That's what we do with all our clients. It's a progression we use. We develop sagittal plane stabilization through our happy baby and other patterns. Then we develop dissociation of the thorax from the lumbar spine and pelvis. Next, we'll go into how do we start to load this pattern up in the upright position. And we'll really be training the control of rotation first, because you must control a motion before you actually develop the motion. So this motion, we help develop thoracic rotation. Now we'll add some resistance and control rotation through our upright cable rotation pattern. So we'll go over that in video 3. Hope you liked this video. If you liked it, feel free to pass it on. This is Dr. Evan Oso with Integrative Movement Insider. We'll catch you in part 3 next time. Take care.